So, what is functional medicine? When people find out I'm a doctor, they often ask, what kind of doctor? And when I say functional medicine, they get this puzzled look on their face and they go, what is that? Functional medicine addresses the underlying causes of disease. It's easiest to understand the difference, I think, by contrasting functional medicine with traditional medicine. What we call traditional medicine is the approach that developed in the second half of the last century. Traditional medicine is designed to manage symptoms. So when you go in to see your doctor with a particular complaint, you'll usually be given something to address the symptoms. And it doesn't matter if it's a digestive issue like reflux or constipation or hypothyroid symptoms or diabetes. The treatment is directed towards the symptoms and not why you have the symptoms. Think of it like this. Your car's looking pretty bad. You take it to the body shop and the guy says, oh, you have some rust. Let's spray some paint on that. It'll look better for a while, and if it comes back, we'll just spray some more paint on it. Now you know intuitively there is something wrong with that. You have to fix the rust first. Functional medicine is directed towards fixing the problem, not covering up the symptoms. There is a reason your thyroid system isn't working properly, or you're having digestive issues, or suffering from depression, and so on. Something isn't working the way it's supposed to. The major premise of functional medicine is that using science, clinical wisdom, innovative tools, we can identify the underlying cause of chronic disease and fix it. By shifting the traditional disease-centered focus of medical practice to a more patient-centered approach, functional medicine addresses the whole person. Now, what does that mean? It means you're not a symptom. You're a person, and you're unique. Over the last century, there has been a dramatic shift from acute to chronic disease. 70% of all diseases today are chronic. The current healthcare model fails to confront the cause of chronic disease. Despite amazing advances in treating infectious disease and trauma, the acute care model that dominated the 20th century is not effective in treating and preventing chronic disease. Functional medicine is the next step. It's the evolution of medicine. It addresses the healthcare needs of the 21st century. You need to ask yourself what kind of a doctor you're looking for. Someone to manage your condition and your drugs, or a doctor who will take the time to understand you and develop a plan for you. Why doesn't the old model work? Because chronic disease is lifestyle driven. It won't be conquered with drugs and surgery, however helpful those tools may be in managing acute signs and symptoms. It won't be conquered by the next miracle drug. By actively listening to a patient's history, mapping their personal story, the functional medicine provider identifies the predisposing factors, triggers, and events that shifted the set point from health to illness. Functional medicine addresses the whole person, not just an isolated set of symptoms.